DBT has a simple and singular purpose, and that is to help you build a life worth living. A life worth living as defined by you and by you alone. It is not focused on helping you fit in better or to be more widely accepted. It solely cares about your life of purpose, meaning, happiness, and calm. The D stands for dialectical or opposites, opposing. In this case, it is acceptance and change, and the recognition that working with both of these at the same time together yields a far better outcome than focusing on only one or the other. The B is for behavioral, recognizing that our thoughts, feelings, and impulses strongly influence our behaviors and vice versa. DBT is not a suicide prevention protocol, and it's not exclusively for people with borderline personality disorder. It can be highly effective for anyone experiencing intense and recurrent feelings such as guilt, shame, anger, mood lability, suicidal thinking, and a range of others as well. The first core principle of DBT is mindfulness. Mindfulness is the skill at being more present in our immediate life and to stop dwelling in regrets and mournfulness about the past or fear and anxiety about the future. By being present in our immediate life, we can be much more receptive to small but important pleasures that can occur day by day. The second core principle is interpersonal effectiveness and being able to communicate our feelings with others without it being destructive to the relationship or leading to fights. We can be able to feel free to share our agreements and our disagreements, our strongly held feelings in a positive and healthy way. The third core principle is distress tolerance. This is the heart of acceptance and change, being able to recognize that we can tolerate our distressful feelings without having to have the impulse to act immediately. We can develop skills in self-soothing, in gentle distraction, and in cognitive processing, such as recognizing the pros and cons of situations and of acting out. And the fourth principle is emotion regulation, learning to identify and name negative emotions and to be able to connect them with specific triggers is far different than feeling overwhelmed by seemingly random and chaotic feelings that simply come upon us and take us into a very bad place. You may find that you start feeling better almost immediately. This could be from recognizing that you've taken an important step to join a protocol that has been shown over many years to be effective. It's very likely that there will be some backslipping. As human beings, we forget things, but for the change to be more abiding, it's going to take a period of months, probably 4 to 6 months. You absolutely do not need to be in DBT forever. In fact, that is not the best way to pursue it. It's a way of helping you get back to your life. It is not a way of life. It's very likely that you will want to come back and take a refresher. As human beings, we do slip back, we do forget things, and reminders can be extremely helpful. How do I get started? Well, first, get a good therapist that you can see weekly who's skilled in DBT, create a support network, and join a DBT skills group. Boston Evening Therapy Associates is offering such a group. You can learn more about this and register at our website, bostoneveningtherapy.com. Wishing you all the best. Thank you very much for joining me.